Greetings everyone. I am Dr. Soniya Tambe, Consultant Neurologist and Epileptologist at Kauvery Hospital, Electronic City. The World Parkinson Awareness Day, which is celebrated on 11th of April to increase awareness among people about the Parkinson's disease. Parkinson's disease is a neurodegenerative disease, which means that it happens due to death of certain neuron cells which control the body movements. All the neurodegenerative disorders are age related process and are irreversible disorders and have no permanent treatment, and Parkinson's disease is one such condition. The symptoms of Parkinson's disease start with shaking of the hand. So, before the word Parkinson's was coined, it was called shaking palsy. Shaking means shaking of the hands and legs, and palsy means weakness, that is paralysis of the hands and legs. So, that is what the term actually means, shaking palsy. The most common symptom is tremor of the hand, that is shaking of the hand. Instability while walking, the frequent feeling of sensation of falling, instability while walking. The slowing, the patient who gets affected from Parkinson's disease, he becomes very slow to do all the daily activities like brushing tooth, eating, walking, doing the work, all the activities become slow. So, these are the three common symptoms, that is shaking, slowness of all daily activities, and gait instability, that is instability while walking. These are the three common symptoms of Parkinson's. Other symptoms that are associated with Parkinson's disease are psychiatric symptoms. Some people have depression, anxiety, some people have memory disturbances, some people have sleep disturbances in the form of inability to fall asleep and abnormal movements of the legs in the evenings, and also in the sleep, called restless leg syndrome or periodic limb movement syndromes, excessive dream in the sleeps affecting their quality of sleep. Other symptoms associated with are behavior disorders, in which patient becomes very paranoid and very suspicious of the family members and his friend circle. These are the symptoms that are associated with Parkinson's disease. Sometimes they also have urine symptoms, very frequent urinary problems, BP fluctuations, and also gut problems in the form of either loose motions or diarrhea. So, these are the common and uncommon symptoms of Parkinson's disease. Now, why Parkinson's disease happens and who it affects and how to prevent and how to treat it. Parkinson's disease is a neurodegenerative symptom. People above 60 years, with every passing decade, the risk of getting Parkinson's disease increases because it is a neurodegenerative condition. In some people who have genetic factors, genetic risk factors, they get the disease at much younger age, that is less than 40 years of age also. In such condition, it is called young onset Parkinson's disease. And coming to the risk factors, as I said, age is one of the risk factors. People who are having genetic family history of Parkinson's disease is the other risk factor. Poor lifestyle, that is lack of sleep, tobacco consumption, these are all the risk factors. Coming to the treatment, as I said, Parkinson's disease is a neurodegenerative condition and there is no permanent treatment for this condition. Having said that, we can improve quality of life by certain medications, which is called levodopa, and that when we give this levodopa, the deficiency in the brain due to which Parkinson's disease happens gets improved, and many people improve for many years with this tablet called levodopa, which can be given as tablet form, as a spray form, nasal spray form, or even as injection. Psychiatric symptoms can be managed symptomatically with psychiatric medications and counseling and sometimes prolonged therapies. So that is about Parkinson's disease. Though there is no permanent treatment, there is significantly lots of things can be done to improve quality of life. So anyone who is little shaking their hands and has become slow, let us not just attribute it to it is just old age symptom. It is just old age symptom. It is not. It can be Parkinson's disease, especially if they have gait instability. Early detection can help to improve their quality of life by using medications and other therapies, and for many years together, even after the disease process has started, for at least a decade, patient can have good response to the treatment and can prevent complications secondary to Parkinson's disease. Wishing you all best.